Do you know how to assess an ECG for rate, rhythm, axis, intervals, waveforms, and chamber enlargement? Well, if not, this video is about to guide you through the process, breaking it down into simple, easy-to-understand steps. First, we'll examine the rate. The normal heart rate is between 60 and 100 beats per minute. If the heart rate falls below 60 beats per minute, we have a condition known as bradycardia. On the other hand, if the heart rate exceeds 100 beats per minute, it's called tachycardia. Next, we'll look at the rhythm. Here, we're looking for a sinus rhythm, which means there's a P wave before every QRS complex and a QRS complex after every P wave. We'll also look out for irregular rhythms, junctional or ventricular rhythms, where there's no P wave before a QRS complex, and ectopic beats. Now, onto the axis. The normal axis shows an upright QRS in leads Y and AVF between 0 and 90 degrees. Left axis deviation presents with an upright QRS in lead Y and a downward QRS in lead AVF. Up to negative 30 degrees is still considered a normal variant. Right axis deviation, however, is characterized by a downward QRS in lead WANs and an upright QRS in lead AVF. Up to positive 105 degrees is considered a normal variant. Then, we'll evaluate the intervals. The normal PR interval is between 120 and 200 milliseconds, with the QRS complex being less than 120 milliseconds. Atrioventricular AV block is diagnosed when the PR interval is greater than 200 milliseconds, or when there's a P wave with no QRS complex afterward. Left bundle branch block, LBBB, is characterized by a QRS duration greater than 120 milliseconds, with no R wave in V1 and wide tall R waves in I, V5 and V6. Right bundle branch block, RBBB, on the other hand, is identified by a QRS duration greater than 120 milliseconds, an RSR complex, a QR or R morphology with a wide R wave in V1, and a QRS pattern with a wide S wave in I, V5 and V6. Lastly, we have the long QT syndrome, which is identified when the QTC is greater than 440 milliseconds. This is an underdiagnosed congenital disorder that predisposes individuals to ventricular tachyarrhythmias. So, to recap, we've covered assessing the ECG for rate, rhythm, axis, intervals, waveforms, and chamber enlargement. We've broken down the assessment process into easy-to-understand steps, from understanding what a normal heart rate is, through to identifying different rhythms, evaluating the axis, examining the intervals, and identifying potential congenital disorders. With these steps, you can methodically assess an ECG with confidence.